Good evening, I'm Courtney Jerome. Thank you for watching Ask the Specialists. Tonight we are asking the doctors live on CMU Public Television. Tonight, our conversation is fueled by your questions, so we invite you to call, tweet, or Facebook us your medical questions so we can ask our doctors live in studio tonight on CMU Public Television. Thank you both so much for being here tonight. We'd like to introduce you to our two doctors. We have Dr. Deaton and Dr. Kirby, and they are here to answer any medical question that you might have, whether it's very general about your health or maybe on the topic of urology. So again, our phone number is 1-800-727-9268 and will be at the bottom of your screen throughout the program. And you can also send us a tweet. We are with AskThe, WCMU_AskThe, and you can go to our Facebook page as well, facebook.com/AskTheSpecialist, to write to us with your medical question. So I'd like to just get started with introducing you a little bit more formally to our doctors that we have. Dr. Deaton, you are the medical director at CMU Health Services. Can you tell us a little bit about what your day-to-day is like?
About what my day-to-day is like?
Yes, please.
That's interesting. We see students on a walk-in basis, so whatever happens to be going around campus at the time determines what we see in clinic. My time is 60% hands-on patient care. I get about 10% of my time allocated to running the clinic, and then the rest of my time is spent teaching the new medical students at the new medical school.
Excellent. So you will be able to answer a wide variety of medical questions tonight.
Hopefully.
Okay, great. Well, thank you very much for being here. And then you are joined by Dr. Kirby, and you are a urologist with McLaren Central Michigan. Can you please tell us a little bit about what kind of questions you'll be able to answer tonight?
Since I'm a urologist, we deal with anything that is related to the kidneys, bladder, in males, the prostate, and kidney stone disease is a particular interest of mine as well. We have any of those questions in that realm are perfectly acceptable, and certainly we're happy to be here, both of us for sure, and we appreciate you asking us to be here.
Well, we appreciate you being here. So I guess we'll just kind of get started with a very common medical question about the flu. What is the best time of year to get a flu shot? And now that we're in April here, is it too late?
The technical answer on that is never too late to get your flu shot. We are coming into the end of flu season. It depends on what authority you pay attention to. It either happens at the end of March or the end of May. So the best time to get your flu shot is in the early fall, late summer, early fall, when the vaccine first comes out, so that you're protected when the height of the flu season hits in late fall, early winter.
Okay, excellent. And now, Dr. Kirby, a question for you. When is a good time for men to start prostate screening?
The issue of prostate screening, and that's a good question because it has been somewhat controversial lately. The government commissioned a task force that looked at PSA blood test screening and whether it was feasible or whether it was a good type of test. And the answer to the question is that it was considered to be a non-economical or a non-efficient way to screen prostate cancer patients. So there's no clean answer to that. The facts are that the American Urologic Association, of course, said this is quite ridiculous because we've been using this test to screen for prostate cancer. And so the conclusion that we have come up with consensus-wise with the AUA is to say this is a decision that's between the patient and the physician, and that high-risk groups such as African Americans and people with family history should be screening themselves, and that is appropriate, and that those groups should start at least at age 45, if not 50.
Okay.
And that we should probably, in the long run, and one of the things that points of emphasis is that in the older patients, 65, 70, and on, that the decision becomes more of a choice rather than a strong suggestion by the urologist.
Okay, now how often should those appointments be scheduled?
Depending on what the situation is, and I'm a little bit different because I'm a little more compulsive about it. The family history patients I'll see every 6 months. The normal screening patients who we have mutually decided to go ahead and screen, I'll see them once a year with a blood test and an exam.
Okay, excellent. Now, Dr. Deaton, we have a question for you. This one is coming from Lincoln. A caller is asking about IBS. Is there a cure, or what kind of damage can it do?
I'm assuming that this person is asking about irritable bowel syndrome, and there's no cure. There is no cure for that problem. It's a chronic issue. It waxes and wanes over time. Some people get over it with time. It's really not damaging. There's really no long-term damage that comes from irritable bowel syndrome. It's just irritating. And the best thing people can do is eat a healthy diet. We recommend lots of fiber. And for people who have severe symptoms, there are medications that we can give that will reduce the spasms and reduce the symptoms. It's aggravating, it's a long-term issue, but there's really no long-term damage from it.
Okay, excellent. Thank you. This caller is from Traverse City, and they were hoping that you could discuss Parkinson's a little bit for them, maybe discuss the causes and go into it in a little bit of detail, if you could, please.
Parkinson's is fairly common. It usually occurs in older people, of course. It can affect younger individuals. I mean, and probably the most famous example is Michael J. Fox. It's caused by abnormalities in neurons in the brain that are in a place called the substantia nigra that make dopamine, and the primary abnormality is that these neurons aren't functioning normally anymore, and the regulatory functions that they provide aren't happening anymore, and that's what causes the tremor. That's what causes people not to be able to move very well, and eventually in some people actually leads to some cognitive decline. It is treatable. It is not curable, although there is some hope on the horizon based on some experimental studies that stem cells could possibly someday provide some relief to people with Parkinson's.
Interesting. Okay, thank you. This caller is from Maple Rapids, and it's about a thyroid. How do you stop an enlarged thyroid from growing? Looks like their tests all have normal levels.
The answer is it depends on what's causing it.
Okay.
There are treatments for enlarged thyroids. If you know the underlying cause, and if it's one of the treatable causes, you can stop the thyroid from growing. If not, then there are procedures that can be done that basically kill the thyroid.
Okay.
And stop it from growing and get it to shrink down. People who undergo those procedures have to be on thyroid hormone replacement for the rest of their lives, but other than having to take medicine every day, they usually do fairly well.
Okay. Okay. Well, thank you, everyone, for your calls this evening. We can hear our phone going off here in the background. And so we'd like to thank you for giving us a call at that 1-800-727-9268 number. And we're also receiving questions via social media, Twitter and Facebook. And one of those questions that we just had come in is from Twitter. And they ask, why is my kidney still swollen months after kidney stone removal surgery?
It's an excellent question, and of course I'm going to be commenting about something where I haven't seen the x-rays and so on. But the idea is that it depends on what type of kidney stone surgery that there was, and it depends on what your definition of swollen is. So if it's something that's seen on an x-ray, then the possible explanation would be, and if it's a shockwave treatment, that You can get some transient swelling in the kidney because you're bruising the kidney when you do the shockwave treatment, which is a way to break up kidney stones. If the stone removal was done through a scope all the way up into the kidney, it's possible that their kidney is swollen, and if swollen means what we call the collecting system, or the area where the urine goes down and through to the bladder is dilated, it could be because there's still obstruction there, or there's some type of mechanical obstruction. The other thing that could be going on is that in a lot of cases, even though we correct the stones and they've been there for a long time, this whole system could be dilated or swollen, as it were, and it will just remain that way if it's not a functional problem. So it depends on whether it's an X-ray diagnosis or whether it's a physical diagnosis, and again, based on the question, I don't know that. But those are some possibilities.
Okay, thank you. Dr. Jeeton, this question is for you. The caller is from South Boardman. She is a 99-year-old woman who went to the dermatologist. Okay. She was treated for skin cancer, found out it wasn't skin cancer. There's a rash on her ear, arm, body, and face. Kind of looks like a burn. The dermatologist sent her to the ER, and she was under observation. She was wondering if you have any ideas on what it could be. It sounds like she knows of a 90-year-old man who has the same symptoms as well.
So it was originally diagnosed as skin cancer.
Treated for skin cancer, found out it wasn't.
The problem is that skin only responds a certain number of ways, and that the underlying problem, with the skin just being red, it really doesn't give me enough information to answer the question. I'm sorry.
Okay. Do you have anything that you would recommend, anyone that you'd recommend her to go see? Sounds like she's been to the ER and to dermatologist.
She's already been to a dermatologist.
Mm-hmm.
I'm of an age where I would recommend find yourself an old dermatologist who's seen a lot of stuff, and get your dermatologist to ask for a second opinion from the old guy.
Okay, to get another opinion. Okay, excellent, thank you. Another kidney question for you, Dr. Kirby. Should someone with a bad kidney GFR of 27 be subjected to a nuclear stress test for heart problems? This question's coming from Clinton Township.
Okay. So more of a question of kidney function, which is more in the realm of the nephrologist. But if you have a diminished GFR, which is just basically diminished kidney function. So recently, the nephrologists, the internal medicine doctors have started using that blood test and estimating the GFR a lot more than we used to in years past. And so that number has caused a lot of consternation among patients. And so the explanation is that all you're doing is saying that your estimated kidney function is a little bit lower in this situation. So in terms of the nuclear testing, that doesn't affect kidney function, at least the nucleotides that we use for kidney function examination. I'm not entirely familiar with the cardiac ones, but I don't feel like they affect the function of the kidney.
Okay.
Whereas contrast material, or a gadolinium for MRI protocols of imaging, will affect the kidney function.
Okay, thank you. This caller is from Owasso. They're wondering a little bit about nutrition and specifically breakfast, what the amount you should really eat for breakfast time. Is a banana all right? Should they be having more? What would be the proper portions, and what would a daily breakfast consist of properly?
There are opinions all over the place on this. What we know is that there are people who are sensitive to, in fact, NPR ran a story on this just last week, or earlier this week. There are people who are especially sensitive to carbohydrates, and they gain weight like crazy on foods like bananas. And what they really need to do is focus on proteins. And there are other people who seem to do just fine following the traditional food pyramid of whole grains in, limited amounts of fat and limited amounts of protein. I think what we're learning is that it's incredibly individual as to what you should have. Now, there are certain things that you really ought to stay away from. You ought to stay away from saturated fats. And, going down to the local diner and having the farmhand breakfast that has everything on the menu is probably not something you should do. But I would say that if it's a person who is struggling with their weight on traditional diets, then focus on proteins and try and get about a third of your daily calories in that first meal of the day.
Great, thank you. Now we have a lot of great questions coming in, so we're going to try and get to as many of your questions as we possibly can. This question is from a caller in Maple Rapids. Can too much insulin raise blood sugar by stimulating the liver to produce sugar?
Can too much insulin?
Can too much insulin raise blood sugar by stimulating the liver to produce sugar?
I've never heard that. And I'm trying to think of a mechanism whereby it would, but nothing's coming to me. That doesn't. But I'm not an endocrinologist,
Okay.
So don't take my word for it on that one. But I've never heard of that happening. I've never heard of insulin causing too much sugar production.
Okay, great. We'll move on to the next question then. This one is from Everett. It's about an 88-year-old. And the question is, once a person becomes incontinent, possibly due to prostate, can it be reversed or stopped?
I think that that's basically is the topic of male incontinence if we're talking about prostate disease. And male incontinence really consists of number one, overflow incontinence, that is, the bladder's too full, and it's like a bucket that just keeps getting water poured into it. It just leaks over the side. And so the bladder's full, and the individual just dribble. So that's one type of incontinence. So our evaluation would be is we do something that's a little modified ultrasound called a bladder scan that just makes sure that the bladder's totally, not totally full, and that they're not just dribbling over the top. Most male incontinents, unless they've had previous prostate surgery, and I don't know if that's what the caller means in regard to prostate, but prostate surgery is really the major reason that you would have what we call stress incontinence, which is leaking with cough, sneeze, lift, or change in position maneuvers, okay? Most males who have not had previous surgery, if they have incontinence, they will have what's called either post-void dribbling, which is dribbling after they're done urinating, or they'll have what we call urge incontinence, which is a strong urge to go and can't get there in time. So urge incontinence is readily treated with a variety of medications. Post-void dribbling, we can recommend some mechanical maneuvers to help with that. And then the stress incontinence in males is really, there's two surgical procedures to correct that. One being something called an artificial sphincter, which replaces the regular sphincter with a device that will compress the urethra and hold the urine back, or a male, M-A-L-E, sling, which supports the urethra and puts a little bit of a kink in it so it doesn't leak out. So there's a lot of options out there for male incontinence. And again, as you get older, these are a little harder to fix, but there might be some simple solution for the problem.
Excellent. Thank you for those options. We appreciate it very much. Dr. Deaton, if we can kind of switch gears a little bit to for our younger viewers here.
Okay.
We have a new mom who's concerned about the vaccines issue. Would you mind briefly discussing the pros and cons?
Sure. Let me go back to the last question. I mean, if you take too much insulin, the liver will react and it will pump out glucose trying to correct for that. But I'm not familiar with any syndromes where it overcorrects. And again, I'm not an endocrinologist, can't answer that. So we have a new mom who's concerned about getting vaccines for her child.
Yes.
And I don't know what the specific mother's concerns are, but typically the most popular one these days is the supposed risk of autism that may or may not be linked to some of the preservatives that are contained in some of the vaccines. There have been multiple studies at this point that show that there really isn't a link to autism. There's a lot of anecdotes. There's a lot of people who would like to attribute that, but the epidemiological studies, the population studies, just don't support it. Now, on the other side of that, you know, infant mortality in this country has plummeted since the age of vaccines. And having seen some unvaccinated children who have come down with preventable diseases, some pretty horrible preventable diseases, I can tell you that I got all my kids vaccinated.
Okay, we have another parent who has a question via social media. When their child has a fever, when is it necessary to see a doctor?
Yes.
A fever is the body's normal response to an infection, and in fact, there's some suggestion out there that you really should allow the child to have a mild fever, because most of the viruses and bacteria that invade our bodies and cause us to be sick don't do well at elevated temperatures. So if you'll actually allow the child to run a low-grade fever, you know, 100.5, 101, that will actually help them get well sooner, as ironic as that sounds. And so there's actually some data out there to support that. Certainly a fever of 104, 105, you definitely want to have your child seen. But really and truly, the thing that determines whether or not a child needs to be seen is how they look. And I know that sounds oversimplified, but really and truly, when you talk about children, if the child has a fever of 100.5, 101, 101.5, and they look okay, they probably are okay.
Okay.
But if they don't want to eat, they're sluggish, they're not responding, or they're just so fussy you can't calm them down, then they definitely need to be seen right away.
Okay, thank you. Now, as you can see, I have a lot of questions here. So, and unfortunately, our half hour is already winding down. So if we can try and get through as many of these as possible for our viewers, that would be excellent. This is a female from Roscommon. She's 73 years old with great constitution. Since Tuesday at 4 a.m., she's had some severe stomach pain, and now it's moved to her chest. It looks like Tuesday there was vomiting as well and blood from her rectum. What advice do you have for her?
She needs to be seen. She needs to be seen right away, either by her family doctor or in the emergency room.
Okay, thank you. This caller is from Riverdale. Is there a cure for nuclear muscular disease?
Nuclear muscular disease.
Or do you have somewhere where you would recommend this caller look for that information?
I'm not sure I understand the question fully.
Okay.
It sounds like a neurological problem.
Okay.
And so a neurologist would probably be the best person to consult.
Okay. This caller is from Ann Arbor. The man has a rare condition, autoimmune muscle myopathy.
Yeah.
Thank you. He was asked to take an excessive amount of statins, which attacked his muscles. Is there any possibility he could ever get his muscles back intact?
I don't know the answer to that one. But that, again, that's almost I still think that's a neurology question. What do you think?
Okay.
I
So
think
That's why I
an
became a
essential
urologist.
specialist.
So I don't
Okay.
have to answer
Yeah.
those questions.
Okay.
I think that's a neurology issue.
Okay, okay. And again, a little bit more rapid fire as we have only a few more minutes. Chronic prosthesis, never been able to cure it. This caller from Bridgeport is asking, is there any new treatment for this disease?
Chronic prostatitis is something I see a lot of, and there's a lot of modalities that we use to treat that. And one of the things that we do pretty well around here is we do a lot of chronic pelvic pain treatment with our physical therapists and biofeedback. So that's something that they may want to look into. There's a lot of good therapists, but your physician has to guide you that way.
Okay. This caller from Reed City asks, what tests should I have for a bladder that isn't emptying and there's weak flow?
if you come to our office, we have a little bladder scanner, which is a modification of an ultrasound that'll tell us how much volume you're leaving behind.
Okay.
And then there's also a measure called a uroflow, which is basically the speed of the urine over time. Now, anybody can do that if they have a watch and they have a measuring device. So if you just measure how much you urinated over a period of time, we can tell you if that's an average flow or not an average flow. But we have fancy machines that do that, but it's really just a watch and a volume measurement for flow.
Okay.
But the residual urine assessments are all modifications of ultrasound.
Okay, great. So this caller's from Mid-Michigan. If they're wondering if there's any current research that can reverse the damage of lead poisoning, especially in children.
Okay, let me bounce back to the previous question. I think the caller was asking about neuromuscular disease, and that is a neurologist.
Okay.
Unfortunately, what we know about lead poisoning right now is that if it's severe enough, some of the damage is reversible, but some of the neurological damage is not reversible. We see an awful lot of behavior problems in children that have grown up in environments where there's increased lead levels, and even when you take them out of the environment, they still have problems.
Okay. Okay. This caller from St. John's, very quickly, what causes an enlarged thyroid?
An enlarged thyroid?
Yes.
There's all kinds of things that can cause an enlarged thyroid. There are several autoimmune diseases where your own antibodies attack your own thyroid. One of the most common causes in this country used to be iodine deficiency until we started adding it to table salt.
Okay.
So there's any number of things that can cause thyroid cancer. Can of course cause an enlarged thyroid. So, but there are ways to determine what the underlying cause is.
Okay. Well, I'm afraid this is all the time that we have, and we didn't get to a lot of your questions this evening, which we apologize for. But I do encourage you to head to our Facebook page in the near future, facebook.com/askthespecialist, as Dr. Jeeton and Dr. Kirby are going to be spending a little bit of time with us post-program to answer some of these questions for you. So please head to our Facebook page, facebook.com/askthespecialist. And again, I'd like to thank both Dr. Jeeton and Dr. Kirby for being here from CMU Health Services and McLaren Central Michigan.
Thank you very much.
Thank you.
Appreciate it.
Thank you. Oh, thank you again for joining us. We'd also like to thank our phone volunteers for taking the time to answer your calls. And we hope you can join us next week for Ask the Builders. I'm Courtney Jerome. Have a good night.